Have you ever heard of scabies? This pesky little mite, Sarcoptes scabiei, is the culprit behind a contagious skin condition known as scabies. It's characterized by intense itching, often worse at night, and a skin rash that may present as small bumps or blisters, usually in the folds of your skin. You might also notice thin, irregular tracks on the skin. These are burrows where the mites have been tunneling. So how do these mites get from person to person? The primary mode of transmission is through direct skin contact. However, mites can also survive for a few days away from their host, so shared items like towels, bedding, or clothing can also facilitate their spread. Diagnosing scabies involves a skin scraping, which is then examined under a microscope to identify mites, eggs, or fecal matter. Once a diagnosis has been made, it's time for management. This typically involves medication such as topical scabicides like permethrin or crotamiton. These are applied overnight and washed off in the morning. For severe cases, oral medications like ivermectin may be used, but treating the skin isn't enough. It's also crucial to clean the household thoroughly. All clothing, towels, and bedding should be washed in hot water, and carpets and furniture should be vacuumed to remove any lingering mites. Regular bathing and avoiding skin-to-skin contact can also help prevent transmission to others. Prevention is a key part of managing scabies. This involves education about proper hygiene and avoiding sharing personal items, as well as early intervention to address symptoms promptly and prevent spread. There are some complications to be aware of. Scratching can lead to open sores, increasing the risk of bacterial infections. And even after successful treatment, itchiness can persist for weeks. This is known as post-scabetic itch. Special considerations should be made for pregnant women and children who should consult a healthcare provider before using any scabicides. Immunocompromised individuals may also require additional or different treatment approaches. In the event of an outbreak, community interventions are crucial. These involve identifying and treating individuals in close contact with the affected person and raising awareness about scabies transmission and prevention. Scabies can be confused with conditions like contact dermatitis or pediculosis, which require different treatments. Finally, current research is focused on developing novel therapies to improve efficacy and reduce resistance, as well as enhancing surveillance and control measures to reduce the scabies burden. In summary, scabies is a manageable condition if promptly and correctly treated. By adhering to the acronym PREVENTS, prompt treatment initiation, remove infested clothing and bedding, educate about proper hygiene, verify successful treatment, environmental cleaning, notify close contacts, treat all affected individuals simultaneously, and surveillance and follow-up. Individuals can effectively treat the condition, prevent its spread, and minimize the risk of reinfestation.